program. The speaker for today is Dr. S. Ramakrishnan, Senior Consultant, Rheumatologist, Apollo Hospital, Chennai. The topic is going to be discussed low back pain, seen beyond the disc. The participant can raise a question through chat box. Doctor, now over to you, please.
Good evening, everybody. Because the time is 4 o'clock, so we are approaching the evening, 2 more hours for sunset. My talk today is low back pain, seeing beyond the disc. Because the most important confusion everybody has when they have a low back pain, they think that the pain is actually from the disc. It is not so in so many patients. So we always have to look a little beyond the disc. What they say, we have to look a little beyond the nose. If you take low back pain, it is as common as common cold. There is not any person in this world who goes to the grave without experiencing an episode of low back pain. Probably Adam and Eve. I do not know whether they had low back pain. After that, subsequently, everybody had an episode of low back pain. Now, what is the misery associated with low back pain? Misery of pain. See, just imagine if I'm sitting down here with severe low back pain, I wouldn't be able to address all of you all. This low back pain leads to significant disability. I won't be able to go to for work. So you get absenteeism from work. No work, no pay. So loss of salary. Then people become very desperate and they start doing doctor shopping. And because the low back pain goes in for times for a long period of time, people become very psychologically disturbed, resulting in mental depression. And all these lead to psychosocial problems. So low back pain can definitely be miserable if it goes on for more than 3 months. Just a little word about the anatomy of the spine. You can see there the anatomy of the spine. It includes a vertebra. It includes the interpars interverticularis. And then you have the spine. Then you have the intervertebral disc. And around these areas, you have the ligaments as well as the muscles. When somebody has got low back pain, the pain can originate either from the bone or from the disc or from the nerve or from the spine, or it can be from the ligaments, it can be from the muscles. In addition to that, it can be referred pain from the viscera. Now one can ask me a question, what are the causes of low back pain? The causes of low back pain are, just remember 3 important points. It is mechanical, it is non-mechanical, and then it is visceral disease. So let us get into what is mechanical low back pain. Mechanical low back pain, the first one is lumbar strain or lumbosacral strain. Imagine I just suddenly stand up from this chair. I can have a catch in the back, and that is called a lumbosacral strain, which will definitely settle in a couple of days. Some people can have a degenerated disc, which can cause the low back pain. Other people can have a bulging of the disc. Some people can have spondylolisthesis, in which the spine moves forward. Some people land up with spinal canal stenosis. The classical symptom of spinal canal stenosis is they have neurogenic claudication. When they walk for a significant distance, they develop pain in the back, which actually goes down the thighs, and it will be associated with paresthesia and also mild motor deficit. It will become better when they stand up erect or when they take rest. Another important cause for low back pain is osteoporosis. Last but not the least, it can be fractures. So this is the commonest lumbosacral sprain. And the commonest cause for this is a husband trying to carry his heavy obese wife around in a duet. Ultimately, he develops low back pain. The commonest cause of low lumbosacral strain is lifting heavy weights in the wrong way. So with the result, they develop a catch in the back, which is self-limiting with absolute conservative line of treatment. Then you have a degenerative disc. You see, all the discs are uniform, except one disc has got degeneration. So a degenerative disc disease can also cause low back pain. Now, all of you, if you see this X-ray, the lateral aspect, you see that one vertebra, 1, 2, 3, the third vertebra is actually moved forward just above the fourth vertebra. Or I would rather say L5, L4, L3, L2. So L4 as on for spondylolisthesis over L5, and characteristically you will see there is a defect in the pars interpedicularis, and this is called spondylolisthesis, which is actually demonstrated in a CT scan. Now, one important reason, ladies and gentlemen, you have to think of spondylolisthesis in people who complain of severe low back pain. Sometimes they have radiculopathy, and the most important point, invariably they are obese, and when you examine them, when you go along the spine, you will make the dimple sign, that is the spine will go forward and suddenly it will come dorsal. So that is called the dimple sign. It's very common in people, and if you want to make a diagnosis of spondylolisthesis, you have to take an X-ray of the lumbosacral spine, lateral view, and in total flexion. Total flexion and in extension, you'll have to take the X-ray. This is a classical herniated disc. You see the herniated disc. The disc is going forward and compressing the nerve. So the completely even compressing the spinal cord over here. You see there is a defect in the spinal cord which continues further like that. So herniated disc can also cause low back pain. This is classical lumbar canal stenosis. You see there is this area which is circled in red. That is the area of stenosis. This occurs secondary to a degenerative big disc, ultimately which compromises the neural canal, and people will have typical neurogenic claudication. Lumbar canal stenosis is a definite indication for decompression surgery. That's very, very important, because lumbar canal stenosis, if left, people can go in for paralysis of the lower limbs, involvement of the bladder, and involvement of the bowel. Osteoporosis. Yeah, I'm about 66 years old, so I have a greater chance of developing osteoporosis. A lady postmenopausal has got a great chance of having osteoporosis, and if these osteoporotic people have a small trivial fall, you can see there are fractures of the vertebra. So this is very common. So osteoporotic vertebrae are very fragile and they can go in for a fracture very, very easily. Now, how will you make a diagnosis of osteoporosis? You make a diagnosis of osteoporosis by doing a Dexa scan of the lumbar spine, hips and forearm, and if the T-score is less than -2.5, then it means it's osteoporosis. Please do not forget osteoporosis in your practice when a lady postmenopausal or somebody has been on prolonged steroids, somebody has been immobilized in bed for a long period of time. With a trivial fall, she develops a fracture of the hip or the lumbar spine or the forearm. Kindly think of osteoporosis and get a Dexa scan done. That's very, very important. Dexa scan, no radiation, very simple to do. It is just like taking an X-ray. Now, some people can have low back pain due to fractures. On the right side, you see it's an osteoporotic fracture. On the left side, if you see the lateral view of a person, he fell down and sustained a fracture with displacement of the vertebra. So we spoke about the mechanical causes of low back pain. We shall get into the non-mechanical causes of low back pain. Please remember, low back pain in a person beyond the age of 50, 55, especially beyond the age of 60, you have to think of the possibility of malignancy, multiple myeloma, metastatic carcinoma, lymphoma, leukemia, spinal cord tumors, and retroperitoneal tumors. Among them, the most commonest is multiple myeloma. So when a person above the age of 50, can even be in the 40s, complains of severe low back pain and bone pain, and her anemia is very horrible in terms of 5 or 6 grams, and the ESR is more than 100, You always, and there is mild renal azotemia, then you will have to think of multiple myeloma. Many times I've picked it up. What do? You do the urine for Bernstone protein, the immunofixation electrophoresis for a monoclonal gammopathy, where they'll demonstrate the M band, and then you can do a bone marrow biopsy to demonstrate multiple myeloma. That's very, very important. Never forget low back pain in the elderly, nocturnal with loss of weight and anemia. Think of multiple myeloma. The other important cause for low back pain is immuno-inflammatory. It falls under the realm of the rheumatologist, and we call this a spondyloarthritis or ankylosing spondylitis. You see this person's neck is totally kyphotic. You can also see a dorsal kyphosis, and you ask him to bend and touch the floor with the fingers, he wouldn't be able to do that at all. I see this very commonly in practice. Paget's disease. If somebody has got low back pain, especially beyond the age of 50 to 60, let it be male or even in female, and incidentally they find an elevation of the alkaline phosphatase, then you'll have to do a nuclear bone scan which shows high uptake in the skull, it shows high uptake in the pelvis, it shows in the femoral head as well as the femoral shaft. So you have to think of Paget's disease. So if you see over here, if you, one second, wait. You see, this is the classical high uptake which you see over the pelvis, and it can also be happening over the skull, and that is Paget's disease, which is diagnosed with the presence of alkaline phosphatase, the bone fraction. So if we finish the mechanical causes of low back pain, in the non-mechanical causes, it is mainly with respect to malignancy. The third important one is immuno-inflammatory, that is spondyloarthritis, ankylosing spondylitis. The fourth important cause is infection. If you take infection in this country, you'll always have to think of tuberculosis of the spine. So when a person has got fever associated with loss of weight, associated with severe low back pain in the night, sometimes due to collapse of the vertebra also, you can get a deformity of the spine, what we call the gibbus, then you'll have to think of tuberculosis spine. You can think osteomyelitis of the spine in people who are presenting low back pain with fever. Septic discitis I do see in practice demonstrated by an MRI when there is fever and systemic symptoms. Very rarely it can be an epidural abscess. But remember, low back pain due to infection with constitutional symptoms, always think of tuberculosis of the spine. Now if you see over here, you can see the classical osteomyelitis lesions. You can see the arrow mark itself shows, you can see the classical osteomyelitis with subsequent sclerosis. This is very important. So when people present with systemic symptoms, it is essential that you do the imaging, take a radiograph, and the best one will be to do an MRI. Sometimes the CT will also pick up because the CT is very, very sensitive to pick up bony lesions. Now people can land up with what we call a septic discitis. If you see C1, C2, C3 and C4 cervical vertebra, 4th and 5th, the disc is totally destroyed, and this patient had a septic discitis, presented with fever, etc. And actually people had to do a transpedicular aspiration and a biopsy and turned out to be septic discitis. If this presents very early, they respond to antibiotics. If not, they require spinal surgery. You can ask me the question, Dr. Ramakrishnan, low back pain is a very simple problem. Why are you thinking of all this? I'd like to tell you a very important point. What the mind does not know, the eye does not see. So you'll have to think of various causes of low back pain, and then just don't say just because you did an MRI and show some disc lesion, it is a disc pathology. You have to see beyond the disc. You'll have to see before in front of the disc, the viscera. So kindly have a holistic approach when a patient comes to you with low back pain.